Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
Welcome and thank you for joining our weekly podcast, Redefining Medicine. We are pleased to welcome today Educational Directors Dr. Sahar Swadan and Dr. Andrew Heyman. On today's episode, we will provide a behind-the-scenes look at A4M education with a discussion covering the philosophical foundations of A4M education, how A4M education has evolved, and what goes into developing an education program, and more. Thank you, Dr. Swadan and Dr. Heyman, for being with us today.
Thank you, Lindsay.
Thanks
for having us.
Dr. Swadan, you are the Director of Professional Programming, and Dr. Heyman, the Director of Academic Affairs. Will you share how A4M's education has evolved since you first came on board? Dr. Heyman, we'll start with you.
Sure. So I think I've had the advantage of being an educator for a long time and understanding the principles and approaches that are typically applied within a university setting at both the undergraduate and graduate level. I think for purposes of A4M, I tend to sort of focus at the graduate level of education. And I think, from that point of view, you begin first considering what are your assets in terms of, how are we going to educate learners? What are the tools that we can use to facilitate that process? And when I first joined A4M, it was a pretty traditional model. It was what we consider an in-person lecture-based model. And we know that, that only goes so far in terms of acquiring new knowledge and translating that into skills. So over time, we began to change the delivery model of education to include more case-based learning, group learning, experiential sessions within the live events. And then several years ago, we were able to adopt the online learning platform called Blackboard. And this is what I had become familiar with at George Washington University when I had assembled our master's degree program. And I became, really familiar with and enthusiastic for what we call mixed modal learning, which is both online and in person. And so we really began to expand our capacity to deliver all types of education, targeting learners in different ways to ensure that over time they become what I would consider a complete practitioner. And to that end, we are now beginning to look more like an academic or university-based educational organization because of the diversity of education that we're now able to offer. It's far more complex. It's much more robust, and we have better and more precise ways to track learner outcomes and to stay in touch with learners over time. So I'm, delighted with sort of where we're at in terms of that migration from sort of the traditional style to a more university-based style. I certainly couldn't have done it without Sahar, because she brings the same sensibility. And I think that's always been our dream, is to ensure that we are the highest level of education in the world for this topic. And the only way to do that is to apply an academic approach with foundational principles around, the educational process. And so, I think we really have achieved that in the last couple of years when you look at our portfolio of what we offer in terms of learning experiences.
And I think just to kind of piggyback on that, obviously myself and Andy have always been involved in the academic world, lots of research publication, academic teaching, curriculum development, at the academic university level. And I think what we always, and, I guess I'll speak for both of us for a minute, and what I've always felt was a deficiency is really the scientific and clinical validation of what we all did clinically to improve these patients, because we come and learn these tools, but we really needed to bring the academics to it also and continue to validate this model of patient care, because all day, every day, we see people improving, changing people's lives, figuring out, some of the dilemmas and the medical puzzles, if you will, that patients had, that in our allopathic model, we did not have some of these additional tools or biomarkers or this additional testing where we could figure out some of the clinical issues and validate the symptoms, if you will, and then develop a treatment protocol. And I think that's where our passion continues to be, is we really want to bring that academic modeling to the education and what I call synthetic modeling. So we've really have redesigned and continue to design and bring forward medicine topic and latest research, where we build it like a university curriculum, where you learn, okay, what's the problem in the disease? What's the latest research and science in that disorder and disease state or body system? Because we still need to know that as clinicians. And then we're adding our forward-thinking medicine, some of the stuff that's well validated in the literature, but has not made it to mainstream yet, whether it's biomarkers, certain tools, certain testing that we have, other treatment paradigms, teach them these additional tools to expand their toolbox and then release them into the world. And I think our next big job is to really collect all this data universally, if we can, from all these clinicians that are doing this forward type medicine, as we're calling it, to collect data and really publish and research and continue to validate the clinical successes we see every day.
What are the main pillars or philosophical foundations of A4M education? How does this differ from other available medical education? Dr. Heyman, we'll start with you.
It's a good question. And Sahar and I were speaking about this the other day. And for me, I think there's sort of three broad areas that we tend to focus on as a way of organizing our training. And sometimes these are, this is an approach that's obvious, and sometimes this is not obvious, but these sort of core principles or ideas are sort of always in the mix to one degree or another. The first is, as an enterprise, you understand quickly, once you even dip your toe in the water of this sort of clinical approach of A4M, is that it's a very information-rich experience. And in some ways, we're sort of junkies when it comes to our enthusiasm for collecting data on an individual patient. And we have access to an expanded toolkit of tests and assessments that go beyond sort of the standard of care in conventional medicine, which creates all sorts of enthusiasm. I also think it creates an intrinsic challenge that the more data you collect on an individual, the harder it is to really understand what's meaningful information and what's not. So one of the big challenges that we have is to train practitioners how to think differently, how to identify patterns in the data that matter, and learn how to apply those patterns in sort of a clinical format. And so, one of the principal foundations is the exposure to the universe of data that's available, and from a clinical perspective, the way to do proper evaluations that can be relatively expansive. But underneath of that, it's teaching teaching practitioners how to think, and making that frame shift away from a disease-based model into a more sort of information-rich network way of thinking. We're connecting the dots and finding patterns and looking through pieces of information to the underlying causes of disease are hopefully available and present. This as an approach is very different than, sort of your standard of care. So that's kind of, principle number one. Principle number two is that the orientation around making those decisions and complex assessments is not towards disease management, but instead building resiliency, mitigating chronic inflammation, improving resistance and durability, and having an orientation towards vitality and wellness. So this notion that instead of taking a piece of information, assuming it's a disease and treating it as such, we cast the net wider. We look at patients as a system of systems. We then think about, how do we nourish that system? How do we nourish that individual to improve their vitality, and therefore, by definition, hopefully mitigate disease along the way? So this notion of regeneration, repair, vitality, resiliency, this becomes the nomenclature and language of A4M, which quite frankly is very different as an approach from disease-based care. And it's meaningful, the way we organize therapies, the types of therapies we select, They tend to be sort of very cutting edge. They sort of have different therapeutic targets and outcomes than just pharmaceuticals. It's an incredibly rich process. It's also incredibly rewarding when you see patients doing better and feeling better and having more vitality and energy. And then the third pillar is what I would call whole person care, that we see people as a total entity in a whole environment, and that we have to take them as, from the perspective of who they are, and really understand them as deeply as possible across that mind, body, spirit axis. We don't just reduce them to molecules and biological processes, but we really want to meet them in terms of where they're at as a person, and support them as individuals that live in a context that matters. And so these three pieces of teaching practitioners how to think differently and collect information differently, having an orientation towards resiliency and wellness and regeneration, and then seeing our patients as whole people in whole environments. I think those three really drive the curriculum into sort of new territories, and the way that we put information together, the experts that we select, how do we consider what's cutting edge within our context in particular. It's a very involved, rich, robust process from a curriculum design perspective, but these are usually the three forces to one degree or another that are driving the decisions that we're making as we create learning opportunities for professionals.
In conventional medicine, the patient is so chopped up, right? If you have a problem up here, you go to the neurologist. You got a problem here, you go to the cardiologist, pulmonologist, gastroenterologist, nephrologist, ologist. There's lots of ologists, right, that patients get chopped up and they go to. And sometimes, we forget that all the system is connected. And it does matter. And that's where we really, again, see the deficiency in some of the conventional medicine education that we've seen. And we've always tried to bring it with cutting edge therapies in A4M. But really, we want mainstream to play that language. I think, why this journey with Andy is so exciting, because of our academic background. We are able to bring in these phenomenal rock stars, as I call them, of latest educators in top in their fields into the A4M, because it's still very important to learn and continue to stay with the basics and the latest and greatest in that field of research. But it's so important to also teach them these additional tools of personalized medicine, precision medicine, which a lot of academic centers are beginning to also speak that language, if you will. And, and before, whenever we would say, adrenals and immunocompetency. And, a lot of times, honestly, our colleagues would look at us, differently, like, adrenals, they only do things. It's either you have Addison's disease or you have Cushingoid. That's it. There is no spectrum of resilience. And now it's really nice to see all the education that we have been doing for the last 20 to 25 years, make it into mainstream medicine. Because now we see the field of neuroimmunology, and how your thoughts do process and change physiology to some degree. And so I think that's been the most exciting section now, where we are bringing that lingo that we've been teaching into mainstream, into our colleagues. And now, they're understanding some of these buzz terms. When we talk now, they don't look sideways to us and they go, oh yeah, that was really cool. Or, back then when we used to talk about the gut-brain connection, 20, 25 years ago, we would get so chastised by some of these, really cutting edge type notions, where now it's mainstream. And I think that's, I just think, they need to understand there's so much work that goes into the development and remodeling of the modules that we have, and the phenomenal foundation that, Dr. Smith has built on these, but now, continue to bring them into forward, 21st century medicine, if you will, and bring the academia into it with these additional tools that we have. And I think this is where truly mainstream medicine is going. And they are looking for continued knowledge and expansion of the utilization of these additional treatments and tools for better patient care. Because it's unfortunate, even in the United States, we're still very behind in chronic disease management. We definitely are the best in acute disease, trauma, surgery, all those things. But when you really look at chronic disease management, we're not doing that great. And I think definitely the system needs to be relooked at in how do we address chronic disease management as a whole.
Talk us through the process of developing an A4M educational program. What primary factors are you considering when developing a new educational program?
It really is a balance. You typically have 24 hours or so to deliver the content, and in terms of at least the lecture and interaction. With that being said, I typically start with what's foundational knowledge. What do people need to know as a starting point for this topic? I don't make assumptions with respect to assuming that everybody starts from the same place. That's a challenge because especially if you're selecting a cutting edge topic, the question is, how much of the basics do you include? You'll find that one way or the other, we're going to include those basics. Now, how we include those basics to some degree changes depending on the topic. Sometimes we can leverage our Blackboard platform or other online platforms where we encourage learners to read foundational academic articles or to prepare for the weekend by watching some basic lectures on the subject. We may even have them answer test questions to assure us that they really are at the same place when we start. At the same time that we have to hold in our head foundational knowledge, we also understand that people are coming because they want to learn something new as well. And so that comes in a variety of forms of, well, you want to be on the cutting edge, but you don't necessarily want to be on the bleeding edge. And I think that the way that we organize that piece is we try and invite speakers that are strong academics on the science and research side of the subject. You will notice now when you attend our modules or conferences, we have literally the best people in the world on the subjects. We work really hard to find those individuals that have the highest level of credibility, the highest level of scientific rigor, and that they are the ones that are really pushing this particular topic forward. Now, the challenge, of course, is sometimes the science is way ahead of clinical medicine, that we might know more about a pathophysiologic process or a disease state or a new therapy that's in its early stages than we really do in terms of the what do I do on Monday morning. So we're always trying to ensure that no matter how avant-garde, no matter how cutting edge the knowledge is as a feature of the module or event, we're always also including practical application. And that means we'll likely be bringing in speakers and experts that have been applying themselves to that particular topic for years. And we want to ensure that that learners walk away with sort of three fundamentals. Therefore, one is knowledge, basic and advanced. The other, skills, so the practical application of competencies. And then the third is attitude, that they over time understand the value of what we're teaching and they become enthusiastic towards it and hopefully integrate it into their clinical practice. So we're always functioning along those lines of knowledge, skills, and attitude, what's foundational, what's advanced, and what's practical. So we have to keep all of this in our head. It's not an easy thing to do when you have a compressed amount of time. Now, obviously, now that we can offer online education that we wrap around live events, we can use that in a way to consolidate knowledge, to offer cases post-event, to ensure that practitioners are able to have a chance to apply it in a moderated fashion with faculty. We do everything we can to help people, take on a new topic and really absorb it really included in their practices in a meaningful way. It's not just a set of lectures anymore. We're very oriented towards knowledge acquisition and skill building. So I think we give this a lot of thought for every single topic. And I know, the person who probably does the most in terms of all the background reading is not me, it's Sahar. I mean, she really scours the earth looking for the best scientists, the best speakers, the best clinicians. And we have a lot of discussion about these subjects. And I think when you look back over the past year or so in particular, the quality of education, the quality of our modules have gone up geometrically, logarithmically. I can say unequivocally that, we really do have the best education in the world because we have the best speakers, the best topics, they're the most advanced, and they're the most practical all at the same time. It's amazing to see the transformation, truly.
We encourage, people even that have taken a lot of the modules to come back because science changes, knowledge changes. And so, what they took and learned, honestly, 3 to 5 years ago, even, or sometimes a couple years, depending on the subject area, is very different now. And there's a lot of advances. And I think, to Andy's point, we're not just throwing, hush posh topics together, if you will. We're really looking at those pillars, the foundational pillars that we covered, with the first question, and looking at truly, getting everybody's knowledge. And if there is knowledge gap, getting the basic and advanced clinicians to the same knowledge level initially, then skill building, and adding these additional tools, which are critical because they're coming to us for the innovation and in advanced treatment options, right? So we definitely keep that at our core. And then also, and so like Andy said, I mean, I'm reading, sometimes we're both very academic geekathons, as I call us, all of our life. And, I'm reading, tons of papers, scouring all these people, if you will, to find truly the best and the brightest start in these fields. And we're bringing them, and they were here. And you will see that as of last year, which was phenomenal to have them, but also to expose them to this world. A lot of them were like, when they saw the agenda, they were like, may I please stay and continue to learn from these other clinicians, which honestly, historically, you would never hear from these high-level academic type centers because they just really focus on their area. They didn't want to learn any other tools, and then they just kind of left. So that's been a phenomenal change where you really see the thinking. Me and Andy sit and brainstorm many, many hours for each module. Once I scour these people, we go through the topics, we go through their expertise, because again, we really want to build the education in a curricularized model that at the end of the 24 hours or at the end of the 3 days, you have this foundational knowledge, you have attained some additional skills, and then helpfully change your attitude about treatment and treatment tools for that disease. But it doesn't stop there. And I think what we saw, myself, and Andy, even in the trenches continuously, is a lot of times I would get tons of calls on Monday morning and they say, God, we loved your lectures, all of you guys, Dr. Smith and Dr. Heyman and Dr. Swadan and Dr. Houston and all of these phenomenal faculty that we have. And they love the lecture and teaching, but then they go, this is literally like going back to medical school. And you would hear that constantly from clinicians. This is a different type of medicine that we're learning, teaching, and additional tools. So how do I implement it? And this is where the other gap that we saw in the industry and in our education, honestly. And I think now what we pushed a bit last year, and we're going to continue to push, is this additional training and hand-holding, as I say. And really, it's really nice because with Blackboard and some of these, ethos and some of the online tools, I think, COVID has its pros and cons now, right? Where it really taught the naysayers that never wanted to do live streaming or online education to really push that, which we've always been in academia, because we've always had to provide teaching in multimodal approach, where now we're able to continue the training. So it doesn't end, if you will, on Sunday evening when the modules are over. We have 2-week continued training programs for some of the harder to grasp topics, if you will, such as hormones, dosing, the science, how to read the science, how to dissect these studies, because that's critical tool to learn. We're all bombarded with information. And I always say in healthcare, especially, there is an infodemic, right? We have all these articles flying in this medical knowledge that flies at all of us at warp speed daily. And it's critical that we stop and learn also how to read the literature, how to dissect it in our respective domains, and how do we translate, what's on paper, if you will, to clinical adaptation and adoption for patient care, and so these are the additional tools that we're also implementing in our education. The difference in the modules, but also post-module continued teaching, learning from how to read the literature and how to stay on top of the literature and how to adapt it into clinical. And so it's been really exciting to build with Andy a lot of the foundations that we have had, with Blackboard and curriculum with 2-week courses, 1-month courses, the SIRS courses, and the continued, availability of faculty, access to faculty, but also case-based learning, and continued professional development.
Thank you. And final question, what are you most looking forward to when you look ahead at the future of A4M educational programming?
I think it kind of comes into two broad buckets. The first is continuing to challenge ourselves with respect to growing the learning opportunities to, again, look more and more like a university, where we have a variety of what we call longitudinal courses, such as 2 and 4-week events online. We've already launched those. So just like attending a graduate school course at your local university, you can do the same now, where we offer a complete exposure to a single topic. It could be hormones, it could be mold and Lyme, it could be cardiovascular. I'm very proud of the fact that we are now offering these events that allow practitioners to really master a given topic. With that being said, again, within the normal portfolio, I also look forward to continuing to invite world-class speakers. And I see this transformation unfolding within A4M, where in the early days, quite frankly, it was hard sometimes to get this quality of educators and researchers. Now, as we've been building our brand and building our reputation, it's become easier and easier to attract truly the best people on any given subject. So I think for me personally and professionally, it's very fulfilling to see the direction we're going in that regard, and to offer the kind of quality education that we can. Beyond all of that, though, beyond sort of this movement further and further towards a true sort of academic platform of learning opportunities, I would also like us to, if possible, move more directly into the clinic and support practitioners through advanced tools, technology, digital assets that allow practitioners to translate what they've learned in our educational environment even more directly into a patient assessment and care. And I think there's a number of intriguing possibilities with respect to moving in a health services direction, where we're able to, on a daily basis, through very advanced tools and algorithms, support decision-making, support assessment, support plan development, tracking, telemedicine and communication assets, all of the features of how do we practice effectively. And I think that also begins to look like a medical center environment, where we have the assets of education that we're putting in place, but then we start looking to develop a health services network. And to do that, you need a certain infrastructure, and we've been looking at what that infrastructure might be. I hope we move in that direction, both in terms of supporting practitioners apply what they've learned more effectively, but it also offers an opportunity to collect patient data and track patient outcomes in a meaningful way. That then would not only offer us an opportunity to engage in the research process proper, but also based on those findings, it could influence what we teach as we learn what really works and how we sort of refine those decisions with respect to patient care over time. So then we become the engine of new knowledge. So I'm hoping we sort of move in that direction at some point. I think the opportunities are there. We just need to seize them. So we're going to do more and better on the education side, and hopefully we'll potentially move in new directions, even on the health services side.
Yeah, and I think, well said, Andy, as always, because that's exactly really our mission and vision, and as you can see, when you look at the curricula, even just this past year, we're going to continue that vision and mission of bringing the best and the brightest and the latest research, knowledge, tools into the into that topic, but also continue to add the cutting edge treatments that you've always come to A4M for, to learn and to implement those in your practices and continue to build, your toolbox, if you will. So that will definitely continue and expand and keep you updated. But I think, the part that I'm most excited about is to continue to build the university setting, the academic world, because that's the part I think that we both love and cherish, and we want to continue to bring into forward medicine thinking in the A4M, because I think that's critical to move forward and continue to be the best in the industry, the most advanced, and literally we want to continue to be the best educators in this field of medicine worldwide. And the way we do that is we continue to build on what we started. We continue to add these longitudinal learning courses that we are doing, because we need to continue with the skill building for these clinicians and continue to fill that gap. But I think the most part that I'm most excited, I think, is the technology and research. I've always been a research and a publisher at heart, just like Andy. And I think we need to continue to validate this world. So yes, we're going to teach you. Yes, we are sprouting these amazing clinicians all around the globe that come and learn from our education, and they go implement this type of medicine worldwide. And now I think with some of the technology and tools that is available and at our disposal to create this micro health system environment for data collection and tools, and also publications, because this is really the part that I see the most efficiency in this type of medicine. And I think we really need to continue to bring the academic realm to this type of medicine and continue to do the research and publication and outcome-driven type research to show the value of these different treatments that we do, and to continue to develop our catalog, as I call it. Myself and Andy's goal is to really have a catalog, if you will, of courses that we offer at A4M, that's kind of disease-based model, but also embodies this mind, body, spirit, and whole body medicine with the latest and greatest tool, where you can come into this university setting, look at the course offering, if you will, and pick the ones that best meet your needs, and also meet you on your clinical and continued educational journey where you're at. If you're basic and you want to advance it, and even if you're advanced, we want to continue to take you to the next level, to join us in this micro environment, if you will, of cutting edge medicine, where we want you to be part of this digitization, collection of data, and research, development, and publication. So that's probably the part that I'm always most excited about in academia and research writing and publishing.
Thank you so much, Dr. Swadan and Dr. Heyman, for sharing the evolution of A4M's education and a behind-the-scenes look at our academic programs. We always appreciate your time and all you do to make our academic offerings available to health professionals all over the world. We truly appreciate you, and thank you again.
Thank you, Lindsay.
Thank you.